Long ago before Obama. Ida, and what else, eh? Day. Give everyone. Everyone, Boko.
My funny. In the way you bring this Ida this morning.
I've been digging up about you.
I
You're
can
most
see.
welcome.
Thank you very much.
Wow, 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 wow,
Thank you
wow.
for having me.
And yesterday was your birthday.
Yes.
Charlie, how young are you? Or you give us your shoe size.
That will pass. 6 years.
All right, so lots of celebrations. Ghana is 65 years. The medical school, University of Ghana Medical School, is celebrating its 60th anniversary. You and I are on the committee. Lots of wonderful, interesting things happening. But it's great to have you. And folks, Jifa is here, kind courtesy of the University of Ghana Medical School, where we both work, and also kind courtesy of Multimedia Ghana Limited, which is giving us some airtime and sponsored interviews to educate and inform you. Today we're going back to understand rheumatoid disease and explain why it is much more than just a joint disease, right? So it's part of the series I'll be doing with Leading Lights Academic Faculty of the University of Ghana Medical School. Jifa, shout out to your year group.
Shout out to the class of 2002. Slash 2003. We are never quite sure where we're supposed to be.
Oh.
But yeah, we're a very special group, so
Right.
we can claim both years for ourselves.
Okay. And indeed, the alumni have been marvelous, awesome in supporting this year's 60th anniversary.
Indeed.
Yeah.
Indeed. There are so many activities that the alumni are participating in, sponsoring. There are so many projects, boreholes, a skill center that the alumni have built that we are launching.
All
We
right.
have a new website for all the alumni called Wave that we are going to launch as well on the 9th
Right.
Of March.
Right.
So a lot of activities for all the year groups.
Okay.
Indeed.
Staff, actual activities, some virtual or online.
Online.
So if you're an alumni of the University of Ghana Medical School, please give us a shout out and join us. WhatsApp is 055 11 11 997. And shortly we'll activate the phone line so you can join us on this very, very informative, educative talk discussion on rheumatoid diseases. Indeed, on the 2nd of February, I had Jifa with the lead of their support and care group, Franklin Hiagbe, right? Is it Franklin?
Frankly, yes.
Yes. We started the basics, but let's just go back to help our listeners understand rheumatoid disease. And I educated myself last time and changed it from just talking about rheumatoid arthritis.
Yes.
So what is it exactly?
So last time we talked about rheumatoid arthritis, but it's a broad group of conditions that fall under an umbrella called rheumatological diseases.
Okay.
So basically, these are diseases where we are concerned about things that affect the joint and the structures that connect to it.
Okay.
So these structures, apart from the joints, can be things like tendons, cartilage, the muscle,
Okay.
and so and things called connective tissue,
Right.
which bind these things together. And so the diseases that affect these structures are not necessarily only joint diseases. But
Okay.
a lot of them are autoimmune conditions.
Right.
And that is where rheumatoid arthritis, for example, comes under this umbrella.
Okay.
So we deal with a lot of conditions that are autoimmune by nature.
Okay.
And when we say autoimmune, it means the immune system is basically confused and starts attacking itself. So auto, self, immune, basically being the immune system attacking itself.
Okay.
And it's then accumulates into various type of diseases, some which may be localized, and like diabetes, multiple sclerosis, that maybe others will talk about. And then the systemic type, where the immune system basically attacks any structure at all. That's it has these things that we've talked about, this connective tissue that it thinks is foreign.
Okay.
And so that results in various disease entities. And under this, we have rheumatoid arthritis, systemic lupus erythematosus, some people call lupus or SLE
right.
for short,
Okay.
and myositis, where it predominantly affects the muscles. We have different types under it. Systemic sclerosis, where it affects the tissue that supports the skin, to put it in very layman's term, and so it becomes stiff and thickened with time.
Right.
And so other organs that have these structures too can become very stiff over time, and then they are not able to expand properly.
Great.
We have things like psoriasis, which is a skin disease that can affect the joint, and so many other diseases, inflammatory arthritis, spondyloarthritis, where it affects mainly the spine, all forming or coming under the
This
rheumatological
whole big
diseases.
umbrella.
The big
Okay.
umbrella.
Now, last time I remember somebody asking for a distinction between what we call your everyday arthritis and the rheumatoid arthritis. What's the
Yes.
difference?
So osteoarthritis also is rheumatological because that affects the joints. But here, the pathophysiology, as you call it, the pathway in which the joint distraction occurs is through wear and tear. So you're growing old, trauma to the joints, and things that cause damage to the joints cartilage, then would result in what's called osteoarthritis, where the covering around the joint surface is lost.
Okay.
And so the joints now sits on each other, it rubs against each other, and incites a reaction or pain, or stimulates the nerve and you get pain.
Okay.
So that is osteoarthritis, and that's the one that most people or people who are growing will tend to complain about.
Okay.
Which is different from rheumatoid arthritis, where, as we were saying earlier, the immune system is the one that goes to attack the joints. Your own immune system that is supposed to protect you now begins to think that, no, this structure in the body is not what it's supposed to be. It's not where it's supposed to be.
Okay.
It's a foreign material, and then it starts to attack the joint.
Okay.
But it's not just the joint. It can affect other structures as well, which have these connective tissue.
Right, we'll get to them in a second. But right about now, I'm sure many of our listeners are wondering, well, why would my immune system do this? Are there any causes and risk factors?
So we know that there is a genetic predisposition for people who develop autoimmune conditions. And there are different genetic markers or genetic makeup for different autoimmune diseases. So the genetic background that would give you rheumatoid arthritis is not the same as the one that will give you lupus, for example. So the genetic makeup is what makes you you, basically. Besides that, it will give me a big ear or something of the sort. So that's genetic background then makes my immune system likely to be overreactive. The other reasons as well, as we are being formed, sometimes our immune system is supposed to be exposed to all the structures in our body. For some people, that may not exactly occur for some reason or the other.
Okay.
And there are certain structures in the body as well which inherently has been designed in such a way that the body doesn't get exposed to it, or it develops later on.
Okay.
Like spermatozoa. The eye, for example, the structures in it, the body doesn't get exposed to it. So if you have something like a trauma to the eye, then whatever is comes out is entirely foreign to the body. So then the immune system will go and attack it.
Okay.
But anyway, so that genetic predisposition is there. So it will not necessarily make you get an autoimmune condition until something comes to stimulate the immune system,
Okay.
which is already
You need a
waiting
trigger.
for a chance,
Right.
exactly, to misbehave. So when the trigger comes, then the immune system starts getting active. So that's why people can get it at different ages. You may have people in the family who obviously should have about the same genetic makeup, but they all don't have an autoimmune condition.
Okay.
Because the trigger is what will set the disease off. And if you are lucky, you don't meet any trigger,
Okay.
then you can go through life without anything happening. Some
Okay.
people may get it early. I have a patient as old as 81 before autoimmune condition came about. I have a youngest patient about 1.5 years having an autoimmune condition. So
Okay.
it can be quite varied.
Okay. Quickly, any risk factors we should be aware of?
Again, it depends on the type of autoimmune condition, rheumatic condition that you are talking about. For rheumatoid arthritis, which we talked about the last time, we know smoking is a trigger. People who smoke are more likely to get it. They are
Okay.
more likely to have more severe disease as well. For something like lupus, for example, risk factors, female sex, you realize a lot of autoimmune conditions, about 85% of people who get it are females.
Right.
So female sex may predispose you to having an autoimmune condition. The hormone estrogen that makes you female, for example, predisposes you to having lupus. So if you have excess of that, or any medication that may have an excess of that, sometimes can trigger it. Some medications can also trigger lupus. Some antibiotics, antihypertensives can also give you lupus. Sunlight can be a trigger for some people in getting lupus as well.
Right.
And so various systemic sclerosis, for example, the trigger will be people who work in the petroleum industry or people who work in mines and are exposed to dust,
Okay.
silica, can then develop autoimmune
Okay,
conditions.
19 minutes past the hour 2 on Joy 99.7 FM. If you've just joined us, you just joined us at a good time. I'm talking to Dr. Jifa Day. She's a consultant physician specialist and a rheumatologist. Indeed, she pioneered and set up Ghana's first rheumatology clinic in 2009. Yep. She also set up in 2012 the Rheumatology Initiative. Right? I get confused whether to say rheumatoid or rheumatology. Right? It's a big mouthful, but that's what she does. She's a very, 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 very well qualified resource person, and we're having her in the studio as part of the University of Ghana's Medical School's 60th anniversary celebrations. We're doing a range of lectures where we are bringing in products, faculty, foot soldiers, and founding members, maybe, if I can say that, of the University of Ghana. The theme for the celebration is building on 60 years of quality medical education, the role of technology. And indeed, Jifa, I'll be coming to that later, right? Because when it comes to diagnosis of these things, there have been a lot of advances that have made it easier
Definitely.
to conclusively diagnose. If you have any questions, concerns on rheumatoid arthritis or any of the many things under Jifa's umbrella, you're welcome to call us 0302-216-541. WhatsApp is 055 11 11 997. So coming back to the issues, we've got an understanding of what causes it or triggers it. It's a combination of factors. We've understood what it is. All right. Arthritis refers to the swelling or the inflammation, right, of the covering of the joints and so on. It also leads to, should I say, a deformation of the joints we learned last time.
Yes, it can.
So it's not just the swelling, it can cause a physical deformity.
Yes. So the starting point is the inflammation,
Right.
which can be triggered by so many different things depending on the disease condition. So it could be autoimmune, it could be infections, it could be wear and tear, degeneration. So they lead to that process called inflammation.
Okay.
So the inflammation in the joints is then what is called arthritis. But the problem with this inflammatory process is it causes damage over time. So it causes the wearing away of the cartilage which is supposed to be the protective agents around the joint.
Okay.
So if the cartilage then goes, then the joint surfaces now are exposed. Bone repairs itself by forming more bone.
Right.
That's how bone behaves. So if there is trauma to the bone, then you start having bits of bone forming. Unfortunately, it's not supposed to be there.
Right.
In that tiny space. So then it's going to cause more pain because now that new bone that has formed is rubbing, is pressing on nerve cells or receptors, giving you more pain.
Okay.
In some places like the spine, if there's more bone forming, it's actually blocking the part of the spinal cord or the nerves. And so when people have spondylosis, it's all because of these little traumas and stuff to the spine, the bone there, which is repairing itself, forming little bits of bone, then blocking the pathway.
Okay.
Then these nerves get compressed.
All right.
So then that is the long-term effect there.
Okay. Jifa, joint pain, aches, and a few other things we discussed last time as early signs and symptoms are quite common. So, at what point do I come marching looking for a very rare specialist like you? Or at what point should a person approach a doctor or a facility with regard to some of these joint pains and joint, should I say, challenges?
Okay. So maybe I'll take it per disease area.
Okay.
Okay, so infections, for example, are an emergency if we have joint pain.
Okay.
So that can manifest with pain, swelling of the joints, warmth, and then maybe the joint looks red.
Okay.
If you have any of those things in the joints, you do not have to wait even a day.
Right.
You should go straight to the hospital, because if there's an infection in the joints, the damage is really rapid, and this can go into the bloodstream. You get what you call sepsis.
Right.
So inflammation, those symptoms in a single joint especially, you should go straight to the hospital.
Okay.
Something like gout might come a bit more slowly, but you can have intense pain and swelling. Anytime there's pain and swelling in a joint, do not stay at home with it.
Okay.
You also should seek some help with it. Now, for osteoarthritis, that's the wear and tear type. That tends to be more indolent, or it comes on very slowly.
Okay.
So pain when usually you move around or you do activity, that's because now the surfaces are rubbing together. So there you need more long-term measures. It's not an emergency, but you need to find the factors that are triggering it. It
Okay.
may be your footwear, it may be because you are walking too much, you are not wearing the right type of shoes, you are standing too much. You need to strengthen the muscles that support the joints. Yes, by all means, you need to see the doctor, but for a long-term plan. For the inflammatory arthritis, or the ones that come from autoimmune conditions, however, typically because infections and other things can give you joint pain. If you remember the last time you had malaria, you realize that you had a bit of aches and pain in the joints, because infections can do that. Usually that will go away within like 2 weeks or so. So if you have pain or stiffness in the joint, you wake up in the morning, your joints feel stiff, and you take a while before you feel like you are loose enough to walk around, and this is persistently going on for more than 6 weeks, that is not a normal type of pain, especially if it's occurring in joints that you typically do not bear weight on.
Right.
The hands, the elbows, the wrist, those are joints that are really not pressure areas.
Right.
So that should tell you that something else is going on,
Okay.
especially if you are a younger person. So this is not an osteoarthritis, obviously.
Okay.
If it comes with any of the symptoms that we say constitutional symptoms, showing that the immune system is misbehaving or causing an inflammatory reaction, like fever, you're having a persistent temperature, you are sweating excessively at night, you are losing weight for no reason at all, an unexplained rash that comes or persisting around, hair loss, those are what we call constitutional symptoms. And so if you have that in addition to joint pain, then that means something internal or systemic may be going on, and definitely, and it's persisting for up to 6 weeks, you should go and seek a doctor's help.
Okay. Right. Great stuff from Dr. Jifade. We're talking about rheumatoid diseases, rheumatoid arthritis. She's mentioned a whole range of them because that's her field, right? Rheumatology, right? She deals with, pardon? Okay, she was agreeing with me, right? I'm at her feet learning. So are you. You can join us by WhatsApp 055 11 11 997. We're particularly interested in alumni of the University of Ghana Medical School, which is celebrating its 60th anniversary, and this discussion is part of the whole celebration. Lots of things happening on the 25th. There's a major lecture. We'll talk about that in a bit at the University of Ghana. Guest of honor is His Excellency, the President of Ghana. And so there are many things happening. If you have any questions on these conditions, you can get in touch with us. WhatsApp 055 11 11 997, and shortly we'll activate the phone lines. We're live on Facebook and YouTube. So coming back to these things, we've understood. But at what point is it conclusively established or diagnosed, and how is that done? And let's see if we can wrap in the role of technology in this, right?
So, diagnosis of any disease requires you to have the symptoms that make you suspicious that this is maybe one of these category of diseases. But then you go to the doctor, and the doctor would examine you to look for certain signs that may match with a disease entity or raise that suspicion. Then the next step after that is to order the appropriate investigations to confirm that diagnosis.
Okay.
So we have different tests for all the various diseases. So in some, let me go first to the autoimmune conditions. In the past, we used to have, for lupus, for example, a test that we call the early cell. You had to take the blood, shake it, go and look at it under the microscope, looking for this early cell to make a diagnosis. It's quite rare to find
You're
it.
doing that actually directly under the microscope.
Yes, we have to look for that particular. So it's basically one of the cells called a macrophage that is engulfing the nucleus of a cell. And so if you find it, then you think that, okay, this is the immune reaction that is occurring, to break it down to a simple
Let me just
level.
pause there. You said in the past. How long ago was that?
Oh, I would say maybe in like 20 years or so. But we're still doing this in Ghana about 10 years ago.
Oh, okay.
Has been what we used for diagnosis. But in other parts of the world, that has been abandoned long ago. So technology has really helped us, because in other places, as I said, the early cell is not what is used anymore. They discovered certain cells or antibodies, which are cells that are formed as a reaction to the foreign agents that the body has been exposed to.
Right.
That it thinks it's a foreign thing. So these antibodies help us to distinguish the various type of autoimmune conditions. And these are tested using various new technologies, multiplex assays that can tell you, run a whole list of these antibodies for you. So you can look at the pattern and see that it fits in with this process.
Okay.
So let's say even 10 years ago, we didn't have these tests readily available in Ghana. So you may have the suspicion, but you may not be able to confirm it. Indeed, we did an audit of patients at the Kolebu Teaching Hospital, roughly maybe around the time I was getting ready to be a rheumatologist.
Right.
And to look at the diagnosis of people who were suspected to have autoimmune condition, whether it was confirmed or not. And most of the patients were actually misdiagnosed as having tuberculosis or HIV initially.
Wow.
Without the benefit of these tests. But with the benefit of these tests, the diagnosis was more streamlined. We were able to make. So you can imagine, even that is in a teaching hospital, how much more in the peripheries.
Right.
And we found out that now that these tests are available, even most people, once they see the symptoms, they are more educated about these conditions. They order these serological tests, the diagnosis is quicker.
Right.
Within 2 weeks or so, just because it's not readily available in country, but you can send it out to South Africa or Germany, and then you may be able to make your diagnosis.
Right.
But people used to just stay on without these diagnoses.
Okay.
For example, rheumatoid arthritis, in the past, again, you needed these antibodies, just the rheumatoid factor, which a lot of the normal population would have. So it's difficult for you to be sure whether it is really a pathological antibody or it is due to a normal aging, considering the fact that rheumatoid arthritis is usually found in older people, and older people have these antibodies for no reason at all anyway.
Okay.
But now we have other things. You can use MRI scans, you can use ultrasound scans to look for these inflammatory signs in the joints to be able to confirm your diagnosis. You can use PET scans to look for high uptake in the joints that show that there's an inflammatory process going on.
Right.
And so you can be more precise and confident about your diagnosis, because these treatments for these conditions are really drugs that are not things to joke with. So you want to be certain about your diagnosis.
Okay. Right. Great stuff. So we've made a lot of progress, right? And we're harnessing technology to be more precise in our diagnosis of these conditions, and then that would inform the treatment and management. Okay. As soon as people hear treatment and management, they are very happy, right? But many go on this labyrinth or this long journey seeking a diagnosis, and then now we've got a conclusive diagnosis, and we've got the technological capacity to arrive at that. All right. Last couple of weeks, we established that this is chronic and there isn't, as at now, what we can call a cure. Can you explain that to my listeners before we go to other areas that these conditions can go into?
So We say they are chronic conditions because it's your immune system. You cannot change it or take it away.
Okay.
Even though it could be extreme depending on how severe the disease is and do something like a bone marrow transplant. So once it is something that you cannot take away, you realize that you would have to live with it. So it's a chronic condition. And our main aim is to try to suppress what the immune system is doing.
Okay.
And you can reach that goal early, or for some people it can be a lifelong process because the drugs are, you need the drugs at a certain dose to try and keep the immune system in that state that it doesn't cause destruction to the body's organs. And so it's not something that you can just start and stop. It's not an infection. It's not malaria that you can treat within a few days. The bacteria or the protozoa is gone.
Right.
But this is something that is inherent to you. You need your immune system. You cannot go and wipe it away.
Okay.
So you have to just find a way of making it behave.
Right.
And so then you would have to find ways to live with it.
Okay. So when it, should I say, starts misbehaving, you have bouts of these things. That's what we identified as flares.
Yes.
Right? Just the same way somebody with sickle cell will have a crisis.
Yes.
Right? The person with rheumatoid arthritis will have a flare where the immune system is really acting up.
Yes.
Okay. And your objective in treatment is to minimize these and also kind of regulate or control the immune system somewhat, but you have not cured the condition.
You haven't cured it, yes.
Okay.
Very few instances that you find people who are able to go without medications at all. It's quite rare. Less than 5% of people.
Okay. I know typically chronic conditions are very frustrating, not just for the clinician managing the person, but for the patient or the sufferer. It's very difficult, and of course significant others and family. So it's important to understand these things because we've got a lot of what should I call them, alternative therapies and other OSOFOs and other people telling people all sorts of things. They will default in treatment, they will stop coming for reviews and so on and so forth. So we need to understand this properly. Okay. 35 minutes past the hour of 2 on Joy 99.7 FM. This is from Oye in Afenya. She's welcoming us to her home. Oye, great to have you. Happy Independence Day. This one says, I feel severe pain which runs from my hip to my butt. Or maybe it's buttocks, and down to my legs. This is from Obed in Ablekuma. I guess it's a question of sorts. So if you have any questions, concerns, experiences with regard to rheumatoid arthritis or any of the other autoimmune diseases, I have in the studio with me Dr. Ida Jifa Day. She dodges with the Ida, but I was reminded a couple of weeks ago by Dr. Alberta Palu regards to Ida, and then I got a birthday wish for you from Dr. McLean Okang. He's out in the US pursuing further studies. He's one of my key resource persons when it comes to the dental area. So he sent a message. So if she's your doctor, yesterday was her birthday. We're celebrating her, but we're also learning and educating ourselves on these conditions, how they are managed, and the fact that it is not just a matter of joints. Jifa, before we come to the other areas very quickly, how did you come to set up the first rheumatology clinic in Ghana in 2009? And why did you choose to specialize in rheumatology?
So it was kind of a detour of sorts. So I finished residency in internal medicine, which is the broad group of conditions.
Right.
And then you had to sub-specialize. At the time, I wasn't quite sure. I did a bit of dermatology, that's a skin. I went to Dr. Palu Albert. He couldn't convince me to stay in neurology. Then I finally settled. I was doing nephrology.
Right.
That's renal medicine.
Renal, kidney stuff.
Right. And that's where I actually met a few of, because these conditions previously we didn't see them, maybe because we were missing them or not diagnosing them.
But all this time you're talking about, we had no specialized
we didn't have
units
any specialized
or clinic.
Units, exactly.
Wow.
In dealing with rheumatic diseases.
Okay.
So I met some young people with lupus nephritis, which is lupus affecting the kidneys.
Right.
And I was so impacted by them. I'm like, why should we let these young people get to this extent? Why couldn't there be treatment for these patients before they get to the stage. And the treatment was really horrid at that time. So when someone gets a flare of lupus nephritis, for example, you are supposed to give high doses of steroids.
Right.
These days, because we are managing them, we know that the steroid infusions are there, so the pharmacists are bringing it in. Those days they were not there, so a patient could pop like 100 tablets at a go. I went to meet one young girl holding like 100 tablets in her hand and just crying one morning. She just couldn't bring herself to take it. Imagine taking that every day. And that's just one of your medications, because she needed to have a high dose of steroids.
Right. So at that time, they were being seen by what? General physicians or?
So the internal medicine people, the nephrologist, depending on which part of the body you are manifesting the most severe disease. So some of them would end up in dermatology under the skin doctors. Because it's a systemic disease, it can affect various parts of the body. So if it happens that your kidney is involved, then you end up in nephrology, the kidney doctors. So that's where I was meeting some of them. And because I'd done these rotations in skin and stuff as well, I also saw quite a few of them there as well. So, it became something I was really concerned about. That why don't we have any rheumatologists there? It doesn't look like it was as rare as it was. As fate will have it, Dr. Palu was my mentor, the neurologist. And I discussed with him at the point what I wanted to specialize in, even though I was doing renal medicine at the time and I was set to go out and go and specialize. So he had a conference in rheumatology that he was supposed to attend because there was nobody there. He was like, Jifa, you go rather. I went and I was like, really? This is how rheumatology is practiced in other parts of the world. It is not so abstract. And so I came back, that's definitely this is what I was going to do.
Right.
At that time, I thought I was going to combine it with renal medicine, but as fate will have it, I went off and focused on rheumatology alone.
And the interesting thing, and we were talking earlier, folks, many of Jifa's year group stayed. We know we talk about brain drain, but as part of this celebration, we've got everybody hooked up, right? But a key number of your colleagues stayed, right? So you actually specialized and came back and set up a unit, a clinic.
I actually set it up even before I went for my rheumatology training. So at that time, I was lucky to have a HOD who was very
mention
happy.
The names. Let's
Professor Ofer,
right? Dr.
Palu also
Professor Ofer, that's Francis
Ofer,
right now spearheading medical training in University of Cape Coast.
Exactly.
Right. Okay.
And then Professor Fram of Blessed Mary, he was a nephrologist. So he was really keen because he was a nephrologist and had seen a lot of these cases. So they decided that they will be to set up a specialist clinic, you had to have a specialist, a consultant in charge. So they were going to be my backup for me to start the clinic because I'd done an online course at the time. And so they said, okay, you start, we will be your backup. So then that is how come the hospital allowed the clinic to be started up, even though I hadn't qualified fully yet.
Right.
So then
indeed, the hospital being Kolebu Teaching Hospital, and of course the University of Ghana Medical School.
Exactly, yes.
Right.
So I set it up, went for training, and then I had a colleague at the time, unfortunately, she passed, Dr. Agama. She also joined me. So when I went, she took over the clinic.
She held the fort.
And then she also came to do her training. And then I came back and then we continued until it's...
You know why I'm looking at you in that tone of voice? I want to ask you, so are you the only one?
At a point in time, yes, for a while.
Because I know you're very keen in medical education,
yes.
Right? You, I mean, across the sub-region with the College of Physicians and Surgeons. Yeah. So you said at a point in time you were the only one.
At a point in time, I was the only one. Currently, there are two of us at Kolebu Teaching Hospital. Dr. Emisa, who studied in the UK and came back to join. We have, luckily, currently, we have 2 residents in training. We have about 3.
They're doing their full training in Ghana.
Full training in Ghana for rheumatology. So we are making some headway. Wow. It was difficult initially getting people because even when I was going for training, the thinking was some consultants said, Jifa, why are you doing this specialty? We don't have these conditions in Ghana. I came back and they were like, Jifa, you went and brought all these cases because we didn't used to see them. The thing is, if you are not looking out for it, you don't see them. And with the right diagnostic techniques and technologies, obviously the diagnosis is far easier.
Okay.
So in the past, I mean, they used to be almost like a circus. When you have a case, everybody wants to see it. But now every week you have 5 more on admission.
So you
It's
actually
not a novelty anymore because
made
they are
a
actually
very
there,
critical, decisive impact in the field.
if you like to put it
Wow.
that way.
Okay, we'll claim that, and the medical school will claim that as well. Let me just read a couple of these. Good afternoon, sir. Please, I need Dr. Jifa's advice. I sometimes get burning sensations under my feet and palm. It gets very severe when I take in sugary foods or eat pastries. What should I do? Mary Kua from Ashaiman. Jifa, hang on to that. Let me see if I can do. Not a great topic on our birthday. Shout out to listeners. This is Douglas in DC. All right. This one says, I am a cervical spondylosis patient. When the shaking, sensational feelings, pins and needles are affecting you and you visit the clinic and are given Renev Plus. Okay. I'm also on pregabalin, right? And mecobalamin. You know, one thing I did when I was researching, I found out all the medicines were painful to pronounce. So I skipped them in my introduction. But that's why G5 is here. Abeko, are you going up or down? Okay. I'm trying to... You've changed my screen. Right. Mecobalamin, which I normally take when I'm in severe pain of the back. The pins and needles are better now, or is better now, but I still feel it inside my mind. Is it going to go at all? Ama and Joulu. What would you say to that?
So sounds like Amma has a nerve problem, probably from compression of the nerves.
She started with cervical spondylosis. Yeah,
exactly. So that's how come she's having the burning sensation. And
Okay.
those medications are basically what you call neuropathic drugs.
Okay.
And they are trying to kind of modulate the pain in the nerves.
Okay.
There are various ways to manage them depending on the severity of the nerve damage or compression.
Okay.
The medications is one of them, but
Right.
we have other pain modulating modalities.
Okay.
You can do injections into the epidural tract to try
Okay.
and lessen the pain. And if it's persistent and severe, unfortunately, sometimes surgery is the only option.
Right.
So she needs to really discuss it with her neurologist or neurosurgeon, whoever is managing her.
Okay.
A bit,
Right,
more
great. I'm going to
detail.
activate the phone lines now. 0302-216-541. 0302-216-541. We're talking about rheumatoid arthritis or rheumatoid diseases with Dr. Jifa Day, consultant specialist physician and rheumatologist with the Kolebu Teaching Hospital. She's a senior lecturer with the University of Ghana Medical School. She's a founder and director of the Rheumatology Initiative and plenty other things. And yesterday was her birthday. Right. Hello, Nortey. Dr. Day is my special doctor. God bless you for all the great work you are doing. We love you loads. Happy birthday. Praying for more grace. This is from Yvonne Coleman. Let me see. Scroll. I have severe pains in my knees when I sit. Where is it? Right? Or sleep in air conditioning, but not when I walk. Could that be related as well?
That could be related. So a lot of inflammatory joint pain is worse when you rest it. So
Okay.
that's why they have a lot of stiffness in the morning when they've been sleeping and not moving for hours.
Okay.
They find out that when they sit down for a while and get up, they have to hobble around a bit before the joints becomes fluid enough.
Okay.
So when you are walking, rather, the pain gets better.
Right.
So that's one of the ways in which you can distinguish whether a pain is inflammatory or is degenerative.
Okay.
So if her symptoms sound quite inflammatory in nature, so she should go and explore it.
All
further.
right. Great. You're invited to Ultimate Health on Joy 99.7 FM. We're talking about rheumatoid arthritis, rheumatoid diseases. Phone line 0302 216 541. We're live on Facebook and YouTube. This is part of our series with the University of Ghana Medical School, which is celebrating its 60th anniversary, building on quality education, and of course, roping in the technological angle. If you have any questions, concerns, call us right now. I have a caller on the line. Hello, good afternoon.
Good afternoon, Nortey.
Yes, good afternoon. Who's speaking?
Oti Boateng from Tema.
Right, Oti, share with us quickly.
Person Mr. Trey. Hematray, what is the local name of Hematray? Kutujana.
A rheumatoid arthritis. You want a local name for it
Local
as
name for
part
it.
of the Ghana man. Jifa. Cho.
I know it's not Kotoje. Kotoje is
Kotoje is
just
the
knee.
knee. Right.
It has to be. I mean, rheumatoid, some people say rheumatism, but
Right.
it's not exactly the same thing. Rheumatism is more bone pain.
Okay.
We don't seem to have local names for these rheumatological conditions.
All right.
That's why people think that it used to be rare in our part of the world.
Okay.
But whatever it is, which has changed, whether it's our new diet, stress, or whatever, it's
Okay.
more common. But
Right.
we don't seem to have local names for these conditions.
All right.
Yeah.
Right. Can we go into the other areas? We said it can spread and affect other areas of the body, other systems, other organs. Yeah.
So we mentioned that it's a systemic disease,
Right.
even though the main symptom that people would manifest with early is the joint pain. It can do more than that. So we've had for rheumatoid, for lupus, all these systemic diseases, we have patients who may be referred from different specialties because that is where the immune system attacks.
Okay.
If you remember, we said it's anything that connects to the joints. So these connective tissues can be found in almost every cell of the body.
Right.
From the hair to the joints to the heart to the lungs. So some people may present with loss of hair for unexplained reasons. They may have inflammation in the eye, of the various layers of the eye, which can lead to blindness if it's not noticed early enough and treated.
Okay.
Especially in kids who have the juvenile type of arthritis. Adults typically may notice the pain and redness and go and see the doctor, but kids may not pay attention to it or even complain about it.
Okay.
You may have it affecting the lungs. People have been referred from the cardiothoracic unit because they've come with unexplained fluid buildup in the lungs or around the heart, and they've searched for infections and
Right.
they don't get it. And then later on, somebody will notice that, why don't we test for an autoimmune condition?
Okay.
And then they notice that you have rheumatoid arthritis.
All right. I have somebody on the line. Let me just barge in there. Hello. Good afternoon.
Hello, good afternoon, Nortey.
Yes.
My name is Odru.
Yes, Odru.
Yes,
You're welcome.
I sometimes wake up with one or two fingers curved or is it bent over, and I have to physically straighten them. I don't know whether it's the same thing you're talking about.
Okay. Let me ask you. So he wakes up with curled fingers or bent fingers,
So,
and he has to physically or
pull it.
manipulate them, and
That sounds like what we call a trigger finger. So there are tendons that connect to the joints, as we talked about.
Okay.
So these tendons, when they get inflamed, sometimes the part in which they move becomes very restricted. And so they are not able to pull or bend so easily. And so when you bend it, it gets stuck in that position until you manually help it to go back.
Okay.
And it can only happen if there's inflammation in the tendon.
Right.
If it's a young person, if it's happening multiple times, then it's good for you to go and search for an autoimmune cause, especially rheumatoid arthritis tends to cause that.
Okay.
So that can be the reason why he's getting that.
Okay. All right. If you have a question, concern, experience, share with us 0302216541. Ultimate Health on Joy 99.7 FM. I have another caller. Hello.
Hello.
Yes. Good afternoon.
Yeah, good afternoon.
Right. Your name and where you're calling from, please.
Yeah, I'm Delphinos.
Delphinos.
Yeah, about 3 years ago, I had a condition which I think is still lingering on. That is when I'm walking, I can just go down. I mean, I just pull and then go down, and then I find it difficult in climbing stairs without holding onto a railing. And the condition was you call it polymyositis. I was put on prednisolone for quite some time, but it didn't quite help the situation. It only helped. It only made me put on weight and so on. So at the point I had to stop taking it. And once in a while, I still have that condition.
Okay. So currently you're off the medication.
Yes, I'm off them. Yeah, I'm off it. Yes.
Okay. So did you have a question for Dr. Day?
It's like I don't know. It doesn't seem to have gone. Yeah.
Okay.
So I don't know whether I can ever have it. I haven't tried. Sometimes some even prescribe for me some food supplement. That is also.
Okay. Let me pass you over to the specialist. So you're nodding. You're aware of what he's describing.
Yes. So that is one of the autoimmune conditions that affects the muscles.
Okay.
So polymyositis meaning it's inflammation in the muscles.
Okay.
It can come with skin related conditions, then it's called dermatomyositis. We have different entities
Okay.
of it. So what happens is the muscle groups that help you to we say the proximal muscle groups are affected. So that's
Right.
why it finds it difficult getting up from a sitting position.
Right.
Sometimes
Climbing
brushing
stairs.
of the hair,
Right.
reaching up becomes very difficult because the proximal muscles are very weak.
Okay.
It can be very profound in that the muscles may be so weak that you cannot move, or it can affect the respiratory muscles because
Right.
they are all muscles.
Okay.
And then breathing becomes difficult. So it's very important for it to be under control. Unfortunately, polymyositis, or the myopathies as we call them, they are very slow to respond to treatment. And so
Okay.
that's why he would have that frustration with
Right.
prednisolone. Prednisolone is a steroid that we use to control a lot of these autoimmune conditions. And unfortunately, the side effect is to make you gain weight.
Okay.
But ideally, what needs to be done is there have to be other drugs that also suppress the immune system that are given alongside, so
Okay.
that the steroids can be taken off gradually with time.
Right.
So the weight gain, yes, it is a side effect that we recognize, but he would have to bear with it until other drugs are put in place.
Okay, so he should
Otherwise,
be going
he definitely
back
has to be
to see
going.
his specialist.
Because like we said, it's a chronic condition.
All right.
Especially if he says he's still having symptoms. It can get worse, and that can
Okay.
be really
If I were fast
detrimental.
running out of time, and I've got lots of messages. Last time we had the program, there was a lot of follow up, and I remember calling you, and you gave the number for the clinic, or is it for the support group?
Both the clinic and the support.
Right. Are we able to give that now? All right. Well, I'll give you a breather and read a couple of messages whilst we try and get that, or either that, or we put it back on the page. This one says the question about burning sensations under his feet, Ashaiman, and it relieves when he takes. No, it gets severe when he takes sugary foods. He says we haven't answered this question.
So that again sounds like a nerve issue.
Okay.
It's difficult to place why its response is aggravated by sugary foods and so on, which
Okay.
may sound like something inflammatory.
Right.
But it would be good for him to go and see a neurologist
Okay.
to check whether it is a nutrient deficiency or it is a nerve compression coming
All right.
from other
Okay.
areas. as
Great. Watching you live from Ashaiman. Keep the fire burning. My name is Kwabna Malik. First Sunday of the month. Happy Independence Day to everybody. Thank you, Kwabna. Hello, Jifa. Please, how can I... Oops, where is it now? How can I see or meet you, and where? I'm a rheumatoid arthritis patient. This is Edmond Amwa, and he gives his number. Right. When are you available to the common man like me?
So we run a rheumatology clinic at
Right.
the Kolebu Teaching Hospital,
Okay.
Which is by appointment.
Mhm.
So I'll give the number for the rheumatology, the WhatsApp number.
Okay.
Ideally, Kolebu being a teaching hospital is by appointment.
Okay.
So you get a referral from your primary doctor.
Right.
And then you can book an appointment. You can just send a message to our WhatsApp line with your appointment referral.
Okay.
And then we'll schedule a booking for you.
All right.
And the WhatsApp number is 055 235 9123.
Okay. 055-235-9123.
Yes. If
Right.
you want to reach our support group, however, you can WhatsApp us on 054
All right.
408 9065.
Okay. Somebody says this program should have been in the local language. Very often, my colleagues from Adum and the other places, they grab my guests immediately after the show, and they should I say kidnap them for other programs. Thanks for your contribution. Please, what activities worsen the rheumatoid arthritis?
So cold environment, as somebody mentioned earlier,
Okay.
can definitely worsen it. When you have certain triggers, so someone mentioned sometimes people have certain foods that can worsen it. Stress can be a trigger. A lot of stress, it could be physical, emotional, currently financial stress, all can worsen the condition because then that makes it. People who smoke, if you continue to smoke when you have it, definitely that can aggravate it.
Right.
If you have something like lupus, sunlight can aggravate it. Cold environments, getting any infection can also aggravate this condition for you.
Right. So any of these other areas, heart, lungs, and other things, kidneys that can be affected, need to be what? Identified by the specialist in that area.
Exactly. So you may present with certain symptoms that may show that specifically these areas are involved. So for example, if you have kidney involvement, you may wake up with swelling around the eyes, which is one of the early signs. And when you wake up early in the morning, swelling of the feet, If you have that, then that is an early sign of kidney disease, and you need to go and check it out quickly.
Okay.
Once it's diagnosed early, we are able to manage and treat it quickly.
Okay.
The key is early identification, diagnosis, and treatment for you to have a normal lifespan.
Great stuff, great stuff. We're almost out of time, but let me just get a word from you on this. The treatments, especially the pharmacological treatments, are quite complex, and they are sometimes or oftentimes very strong medications with side effects. And this leads to default. Patients stop coming, they stop treating. We've already established that this does not have a cure as we know it. What would you say to people on treatment? You know, they've been diagnosed, but this is the frustration.
The frustration is, you see, patients, unfortunately, that's why we were emphasizing that this condition is not a joint disease.
It's more than that.
This chronic disease can cause so much damage, reduce your lifespan, cause so much organ damage. If you are told you are hypertensive and diabetic today, most people will come, they are on their antihypertensive and diabetic medications, but they don't want to take their medications for their rheumatological conditions. Because they assume that one is just joint, or that one should settle.
It's more than a joint disease.
It's more than a joint disease.
Many other things are happening
you have
to your body.
Exactly. Control the condition using diet, lifestyle, and your medication. And the good thing about these conditions is if you do that and the condition is stable, you may be lucky that the medications will be reduced gradually with time. But as long as the immune system is active, you need to have something to suppress it so that it doesn't cause damage to you. People who have uncontrolled conditions are more likely to get organ damage. People who have it lose at least 10 years of their lifespan because of having an autoimmune rheumatic condition like rheumatoid arthritis.
Even if they're on treatment?
Even, that is if it's uncontrolled.
Uncontrolled, okay.
People who have lupus, RA, for a young person, even under 40, their risk of getting a heart attack is 40 times their compatriots without any condition. Meanwhile, you don't have any other risk factor for having a heart condition apart from your autoimmune condition.
So you should be seeing the right
You should be seeing and making sure this inflammation is well controlled. It is not just a joint problem.
All right. Edith says she's enjoying the show. This is Edith Arthur. Thanks for listening and tuning in. Good afternoon. I suggest Sasabro is usually the Akan terminology used for rheumatoid conditions. Sasabro. I've heard it before, but I don't have a clue.
So Sasabro is bone pain. So that's why I said it's a bit different.
All right.
Because this is really joints.
Yeah. You know, when you come to our indigenous languages, koko is red. But that for some time now, I've been experiencing excruciating pains with the thighs. It usually occurs in the night. Something similar to muscle pull. I have to get out from bed and walk around the room for some time before the pain subsides. Again, at times, the bigger veins around my legs try to protrude with a pulling effect. Please help me. This is from Yadom Boachi in Obuasi. Quick response to that?
Yeah, probably may have something related to the nerves or a muscular problem. So it's good to see that rheumatologist or neurologist for that to be investigated further.
Okie dokie. Jifa, we've run out of time, but so for somebody like this in Obuasi, what do they do? You are in Accra.
Now let me say something technological that the university has been doing. We started with TRI. We have a free mobile number that you actually can dial into and check whether your symptoms are rheumatological, and we actually link you with doctors. Even though we don't have enough rheumatologists, what the support group or the TRI has done is we've identified specialists in some districts who can at least diagnose and start some management. So you can actually key in and see if your symptoms fit, and you may get a referral to this. We've actually collaborated with the IT department, the Artificial Intelligence Agency of the University of Ghana. And we actually also developed an algorithm. It's not out yet, but using that and looking at symptom complex, it's interesting how much, how very close it is to diagnosing patients. By just using the symptoms that the patient and the signs the patient has.
So you're answering a range of questions, like a questionnaire.
Yes, so you don't necessarily have to see
your responses can be used to
generate an algorithm and see whether really this fits in with a rheumatological condition. So that's some ways in which the university is actually
How do you access that?
We are still. I have to leave this with to Prof to finally bring it out, but
Okay.
it's still in the final stages.
Right.
We are hoping that will be developed into an app, for example, that people can
Some
use.
little e-diagnosis in there.
Exactly, to
Then we
then
can
put-
direct you and pair and link you with specialists close
Exactly.
to you.
Yes,
It's
we
almost
are
like
actually doing that on a low key now, but
Wow.
we are hoping that technology would even be better, refine it.
it's a
into-
blessing.
Exactly.
Almost like hailing an Uber, right?
Especially
You
since we
key
don't
in
have enough doctors.
and it pairs you with a specialist. Wow.
Fantastic, isn't it?
And you're spearheading all of this with
We
the
are
medical
involved in
school.
it. Yes, with the medical school.
Wow, 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 wow,
That's
wow.
the University of Ghana.
University of Ghana Medical School or University of Ghana
University
IT
of Ghana
department.
IT department. Yeah.
Right. Okay. You can see we've breached. We're getting systemic here. We've breached 3 o'clock. We're just sorting out some technical issues, but I'm still with Dr. Jifa Day, specialist rheumatologist, physician specialist as well, senior lecturer with the University of Ghana Medical School. She's here because we're celebrating the 60th anniversary of the University of Ghana Medical School, and all alumni, faculty, academicians are all up there. Joined together for this important celebration. The plans for the medical school started in 1919 but didn't see fruition until 1962. And I believe the first batch in 1964 were about 41. Am I right, Jifa?
Yes, you are.
41,
41,
right?
With
And
3 women.
with 3 women. And today, way downstream, I have Dr. Jifa Day, right? Set up Ghana's first rheumatology clinic here in Kolebu, and more importantly, has stayed here and has been working with the University of Ghana Medical School and doing a great deal of work, also building capacity and training with the College of Physicians and Surgeons, the West African College, and so many other branches she's connected to. So you know why she's doing it? She's in rheumatology, the bones, the tendons, and all the connections. She's using them to help people. Any last words, and particularly also on the celebration as we wrap up?
We invite you all to join us to celebrate 60 years of medical education.
That's right.
Really, it is an achievement worth celebrating, because medical education is not only related to what we are doing or training of doctors. It impacts the whole society. Our education is based on what is happening in patients,
Right.
treatments, and management. So whatever technologies are happening have to be related to how we are training and teaching
Right.
our students. So
Okay.
it's always very fluid and volatile,
Okay.
or we have to be innovative.
Okay.
So we want you to help us develop capacity to do more, because in the end it impacts on the society and
Okay.
how we care for you.
Right. Great stuff. Yadon Boachin Obuasi still wants the contact number again. Can we give that out?
So-
yeah.
For the support group is 054 408 9065.
All right.
And for the rheumatology clinic at Kolebu, the WhatsApp number,
Right.
055 235 9123.
Okay. Great. Dr. Ida Jifa Day. We are immensely grateful, and of course,
you very
grateful to the University of Ghana Medical School for producing you and many others, home and away, who have contributed to health care delivery in our republic, especially on the Independence Day of this Republic of Ghana. We thank you, and we thank the medical school. And on behalf of the, should I say, the team or the committee headed by Prof. Lorna Renner, we invite everybody to join us online, join our activities. There are many things coming, and help us celebrate our 60th anniversary.
And thank you to Joy FM and Joy Prime too for being proud sponsors, helping us to.
They've been
showcase-
awesome. They've been
super
awesome. Yep.
Thank
All right.
you.
Thank you. I hand over to my brother, Bile, who brings us Sunday Rhythms. Stick and stay on Joy 99.7 FM. Many thanks to my producer, Abeku San Kofi, and you, my discerning listeners. I'm out.